It's Saturday at 12 o'clock. That means it's time for the health wrap. Hey, Carla.
Hey, Carolyn, and welcome everyone. We know it's back to school season for the parents and the students and the teachers and the staff. All of them have questions about reopening, and there's a continuous debate in the U.S. ongoing about coronavirus, the epidemic. And doctors will tell you that there's no textbook answer. They go by science. And Carolyn, as you know, some elected officials are punting the political football. So, what's in the news today?
A lot of things in the news. I was just saying it's back for so many things. Baseball came back this week. Dr. Fauci throwing out the first pitch in Washington or Baltimore, was it? Or what are the cities? I'm
It
not a
was at the
baseball.
Nationals and the Yankees game, and not only did he throw out the first pitch, they both of the teams took a knee in support of Black Lives Matters.
Yes, we saw that. That was something that was an interesting discussion for a lot of people. So that happened, and then this morning I stopped literally making my coffee when I heard this story out of Kansas City. I followed the Chiefs for a long time. Kansas City Chiefs lineman says that he is not going to play in this 2020 season. He's opting out. Now, what's interesting about this is that this particular player, Duvernay Tardif, is a doctor. And so he is a trained medical physician. In fact, he says doing some of the work on the front line has made him really realize that he's willing to give up something he loves in order to care for and treat people so that we can get through this pandemic. And so something to pay attention to when you talk about a player saying, I'm a doctor and I'm not going to do this.
Well,
Big story.
well, coaches are also talking, and in Atlanta, we have a story from Fox 5 Atlanta where the high school head coach at Tucker High School, Coach Brian Lamar, he said, I don't think the team should be playing. And here's what he had to say.
I really don't think that we should be playing right now. I love football. We got a really good football team. We got a chance to win a state championship. I'm excited about that. But I'm at a point where it's rather safe for the kids to play or it's not. And if it's safe for the kids to play, it should be safe for us to go to school. And if we can't go to school, then we shouldn't be playing football. And it's really kind of sad that it's not enough adults speaking up for the safety of the kids and the coaches. You know, it's a very dangerous thing. The NFL wouldn't go and play under the circumstances they're asking us to play underneath. The NBA, no major professional league team would play underneath these circumstances that they're asking us to play under. And it's because those players would speak up. These kids aren't mature enough to understand the danger that they're in and their families are in, so they can't speak up against it.
So, Carolyn, Coach Lamar says that his players are in training, but they're social distancing. They because they need to exercise. They're 6 feet apart. They're wearing masks in the weight room. They're running on lines 15 feet apart. And he says this way that they can socialize, and then that he can also see, what's been happening with them. But he said it is not safe to tackle, to jump on each other, to travel on buses, and to be in locker rooms right now.
Well, as they say in the Baptist church, amen to what he had to say. A lot of people aren't speaking up, but the reality is it needs to be said. So it's been said, you heard it here. You need to listen, take heed, make decisions that are appropriate for you and your family. Let me show you, for instance, though, a cartoon that's been circulating on Facebook that has everyone, some laughing, but some saying, true that. What might it look like in the classroom if kids have face masks? Or asked to wear face masks in order to protect themselves. I love the kid who actually has it over his nose, above the nose and above the mouth. Who knows what this could look like, which is why a lot of folks are just saying, a lot of educators are saying, let's just back up. Take Florida, for instance. The teachers union, I believe it is in Florida, has basically said they're going to sue the state over reopening schools if they do that. They believe that the surge means they should not be going back into the classrooms, and they're prepared to sue. This story just happened yesterday in South Carolina, and some of us are just kind of scratching our heads going, y'all, look at what's happening here. Our governor actually retired some board members. I'm going to say retired instead of fired, right? He retired some board members who were on the governor's school board. And why did he retire them? Well, he said the terms were up, but I'm going to tell you, they also came out earlier in the week and said, you know what, we're going virtual because we don't think it's safe to be back in the classroom. So clean slate on the board members, but their position was we shouldn't go back.
Well,
and then Missouri, yeah, go ahead.
And you were talking about Missouri as well.
Absolutely. This governor, you'll love this one. He says the students who actually might go back into the class, well, you know what? They're kids and they're going to get over it. That's the governor. He says they're going to get over it.
Well, I have to say this. He is an elected official. He is not a doctor, but this is Doctors on Call with the health wrap. So we do have a real doctor here. We want to welcome Dr. Christopher Kiefer. He is over the pediatric infectious diseases there at Meharry Medical College, one of our HBCUs here in Nashville. And thank you, Dr. Kiefer, for joining us. As a physician, as a father of twins, and actually you're a COVID survivor yourself. What will it take to bring the risk to a reasonable level as we go back to school?
Welcome. Thank you, Caroline and Carla, for having me here today. You guys ask hard questions. I think the question that involves risk, I think one has to sort of define what that is and sort of understand what a family member's risk tolerance is in context of thinking about sending their children back to school. What I can tell you with fairly good certainty is the risk this falls if and when we send our children back to school will not be zero. It is unlikely to be 100% complete meltdown of all students, staff, and faculty, but it's going to be somewhere in the middle. And I think that how families should approach this to determine if their school that they plan to send their children back to, what will be their risk that they're willing to take. So, for example, if a family member trusts the process that the school is providing a nimble, thoughtful, flexible plan that they can articulate and share with the family, and that brings this risk that's somewhere in the middle between 0 and 100%, bring that down to a lower level, then that family may consider sending their children to school. As you said, as a pediatrician myself and parents, I'm not questioning the importance of school. I mean, we know that children learn best kind of in a social, in-person environment, but there are risks that we know that kids will take going to school. I can help articulate or help families understand that risk and put it in the context of if and when their child is exposed to coronavirus, what will that look like for the family or for the student? The good news is for children, we know that kids, while they're not immune to coronavirus, if they get coronavirus, our experience thus far, not only in the United States, but looking at pediatric cases of coronavirus in other countries, that children, fortunately, are spared the majority of the complications we've unfortunately seen in older individuals with underlying health risk. So that's not to suggest that we just put caution aside and send all the kids to school knowing that they're not going to have complications. It's we know that kids get infected. We know that children will spread disease or infection to other children, their family members. This is a common debate right now, how efficiently children can spread infection to their classmates, to the teachers, to their family members. And as we learn more about this, it will add into sort of our calculus how risky it is to send them.
Now, we have some graphics here, and I know what the CDC. Can you share that information? What is the CDC saying about the number of cases with children?
Yeah, so to answer your question about sort of the CDC number of cases, so in terms of children thus far in the United States who have tested positive for coronavirus, it represents only about 5% of our confirmed cases by testing. And as I said just a few minutes ago, of those small percentage of known cases, these children are, for the most part, experiencing just mild illness, not being hospitalized. We're not seeing the death rates in children, fortunately, that we have seen or are seeing in older individuals. I shared this set of slides with you to point out a much more rare phenomenon that we're seeing in children that your viewers may have heard on the news over the past couple months. There is a condition that has been associated with coronavirus in children that is referred to multi-system inflammatory syndrome in children, or MIS-C. It's an autoimmune phenomenon, or an immune phenomenon, such that when children get infected with coronavirus, after their immune system has finished battling the infection, that about 1 to 3 weeks later, that residual immune system, for reasons that aren't entirely clear at this point, kind of turn itself back onto the child and start irritating a variety of parts of the child's sort of organ system.
Like their eyes and their skin.
Yeah, so here's a couple pictures of a child who recovered from coronavirus, who now is experiencing this syndrome, that parents would be given heads up that their child may have unexplained fever. The child's likely going to be complaining of stomach pain. And what is very characteristic in this syndrome is red eyes, a rash. You can have serious irritation to the heart. And this is something that, while we talk about coronavirus sparing most children who get it, for the 300 to 400 children who we suspect have succumbed to this rare complication, it can be quite serious. The majority of these children who have been diagnosed with MIS-C, or hospitalization is required, often in the intensive care unit. There have been some reported deaths associated with this. So I want to kind of just provide two things: that coronavirus is for most children mild, but I don't want to suggest it's always mild. There are unusual times where children have complications.
Good information. Thank you so much for joining us, Dr. Keefer. This has been very enlightening. A lot of people have been wondering, and I think what I did hear through this is, while the after effects might not be as intense, the fatalities might not be as many, but for a lot of us, just to hear of 1 or 2 fatalities of children involved in this COVID is just too much. But we thank you so much for sharing this information with us.
Yeah, my pleasure. Good luck to all your viewers making a hard choice. We are forced to make a decision that is not easy, and I wish everyone luck finding some balance and insight into the decision they make for their families.
Thank you.
Thank you again. Thanks so much.
Yeah.
You know, I mentioned, Carla, the loss of lives, and the powerful memorial this week in Washington, D.C. on the lawn of the White House. They had 164 pairs of shoes that were placed on the lawn of the Capitol, representing nurses who died from the coronavirus. And there's still reports as late as this morning about the staff being fatigued, being, those who are overcome with the disease and still battling it. I heard a physician this morning talking about putting one of his colleagues of 35 years on an incubator. So, I mean, this is tough. This is still taking a hefty toll on those who are on the front line all across this country.
Absolutely. Hats off to all of the healthcare professionals, doctors, nurses, and those who assist them. And we will be right back right after this.
South Carolinians are asking, what can they do to stop the spread of COVID-19? Our response? Answer the call. Through what's called contact tracing, DHEC's trained contact tracers call everyone who has tested positive for COVID-19 and those who could have been exposed. All information is confidential, voluntary, and collected over the phone. This information helps us protect you, your loved ones, and your community. Answer the call to keep your community safe. Visit scdhec.gov/COVID-19.
Okay, so as Dr. Kiefer was saying, parents have a tough decision to make. And we wanted to talk to a parent. We have a parent from right outside of Atlanta, from Fayetteville, Georgia, Orion Mitchell, and her family. They opted to go to full virtual school. So Orion, thank you for joining us. And what guided your decision?
Well, we started when the children were first let out, when COVID first hit. We pulled our children about 3 days before the school did. And so we were kind of ahead of it. And when the children finished the year out, we saw so many skill deficiencies. We also have a child that has an IEP. So we're very in tune into all the services. And then we also have a child that is in the age where they don't receive Chromebooks yet until the following year. So we had to buy a computer for one child and then really try to stay on the services that were, for our other child. And it was just it was so cumbersome. I knew I needed to step back. And just, I think of it as a rework. My children will still receive the academics that they are supposed to receive, but because we have taken a next step and partnered with a lot of the social programs that were already in place that are now forced to go virtual. So we feel like that we're ahead of that, and our kids will have that balance that they need when it comes to social skills.
And when you say virtual, I mean, so you will still be connected to the district, or you'll do a good bit of home teaching or homeschooling as well? What is it?
It's a 100% virtual. Our children will be going to a virtual school, like a charter school, but it's virtual in the state of Georgia. So one of the great things about that, those kids never missed a beat because they were already virtual. And so those kids are now taking a step back because of what's happening with the brick and mortar children. So we had already started that process before COVID, and I'm very happy that it's actually working into our plan. And I am a business owner and my husband as well. So we have that flexibility, and I feel for my parents right now. I'm in social groups. I'm working with our HOA because we have over 380 homes, because we are going to work together as parents and build those and almost like align what will be missing to keep our kids safe.
So you've seen this work in your community, and that's why you all, the parents, have joined together, that you're going to take turns and to also not just rely on the teacher. You're going to be creating some opportunities there for the children, additional learning and socialization that you all as parents are getting together to do.
Yes, Carla. Well, what we've done is we've seen it happen in our subdivision is actually with some Quaker families. So they have like houses for first graders, second graders. They compartmentalize academically. My focus is really social. I am a teacher of adults in my profession. So I feel that my children will have that sense of balance. But for those social skills that are needed with so many children, and I agree with Dr. Kiefer, I wanted brick and mortar, but with this, I don't want to be a part of the 12% or the 5%, and I don't want my neighbors either. And I'm also in a very nice area, but our schools are very diverse where our administration is not. And so we have lack of diversity in thought. And so I just continue to be a part of that conversation and encourage whichever way that, a parent wants to go. It's just a tough decision to make because I know we don't all have the same choices.
So, I'm dying to ask the question, how do the kids feel?
I haven't told them. They just are so afraid of the COVID. And so, one of the great things is being so stuck in the house, we've started a garden. Yeah, those are my babies. We've started a garden. We've painted our deck. We've done a project plan. And so I am very intentional in a lot of the things that we do. And I record it and I share with moms, and we have our own mini Facebook groups, and we just have a different mindset about it. We're going to let them fight it out, but our kids' safety is number one. So.
Love it.
I guess the last thing I would want to ask you, what would you say to the school board?
I would say, look at your district. I would say if you are in a district of multicultural families, and our board of education, our board is all white males. And so that's where I think that we could use some diversity of thought. I think that we should have a representation for all the silent moms who are afraid to speak, not against the board, but say, this is some things we can do to get great. Everybody has room for growth. So I am really hoping that the board would take into consideration what parents want, and that parents just want to have a conversation and be heard. I do.
Well, we hear you loud and clear. We thank you for joining us today and sharing just another way that it can be done. The kids don't have to miss out. It actually can be done. And beautiful family. Thanks so much, Mitchell.
Thank you.
Thank you.
We'll be back after these messages.
Hi, my name is Chef Gabby. No mask is a recipe for disaster. Be your own superhero. Mask up.
Make sure y'all mask up out there and stay safe, and check out my music, Missing Me, and all my other music on all platforms, 615 exclusive.
It's so important to keep your mask on right now. Food is a great substance, and it'll definitely sustain you, but it'll be all for nothing if you get sick during this pandemic, because you won't taste it anyway, from what I've heard from the COVID symptoms. So definitely want to wear your mask. Although I don't have mine on right now, it's just so you can hear me. I guarantee you, everywhere I go, I'm going to keep this mask on, and wear your mask and be safe.
Nice to hear from our friends at the USDA telling folks to mask up. That was a whole series of organic masking up messages. Now Chef Gabby and that batter, that's he could probably tell me what it is. You can tell I don't know my way around.
It's a whisk, and he told me one day that he had his own whisk. So yes,
the whisk was looking like a weapon. But you tell him thank you for our PSA. We'd love for him to be watching each week and checking out the health wrap and Auntie Carla. We appreciate that so immensely. You know, this has been, we've talked about kids in school in the first half, and we're really thinking K through 12, but it's been a tough year for a lot of these students. Those who finished high school, their graduation was already not the graduation you and I remember, Carla. It was non-traditional, to say the least. Well, now you've got those that are freshmen, entering freshmen in HBCUs and other colleges and universities across the country, and that isn't looking like it should, or it used to, shall we say. We've got a couple of those students that are with us, and they have interesting stories. That's the thing. I've often sat up and kind of wondered how, all these different ways that people are doing things creates a little bit of the confusion. But let's bring them on in. We've got two of our entering freshmen. We've got
one
Nash
freshman, one
and Sean Hicks. We call him Nash. Nash is a Morehouse man who will be starting his freshman year at Morehouse College. You see that? Yeah, we see you in Atlanta. And we've got a lovely young lady with us as well, Carla.
Yes, that's Aaliyah. Now Ponder, she is at the University of Alabama, and she is a senior, and she will be doing the hybrid type of education. She's a communications major, she's in criminology, and she plans to go to Yale after she graduates. So welcome, students. We're proud of you all.
Thanks for hanging out with us today. So Aaliyah, what does hybrid mean at the University of Alabama?
So hybrid is a face-to-face component and also an interactive audio video component. We are actually going back on campus. And so students have a mixture of face-to-face classes, hybrid classes, interactive audio visual classes, and also internet courses. So I have all three.
Okay. And Nash, I should tell you, at full disclosure, my brother is a Morehouse man, a graduate of the house. And so what does it look like at Morehouse for entering freshmen this year? What does that look like?
They just announced, I believe 2 days ago, that we're going virtual. Before that, we were going on campus around August 16th, and we were going to have our single dorms, and we were requested mandatory COVID testing, but they switched it to virtual the other day, I think 2 days ago.
How do you feel about that?
I agree with them now. I had to have a long talk with my mom, honestly, because she explained to me all of us coming from different states and different worlds all in one spot. That's really crazy, especially with all the diseases going on right now in the pandemic. It was just going to be a lot for all of us to be in one space. And Morehouse is by Clark Atlanta and Spelman. So all of us together in one spot really just isn't the smartest idea right now.
Yeah, that's
Well,
what makes it so unique. But you're right, that AU center in itself makes it a little difficult. And you know, your mom is a really smart woman. So good advice to you.
Aaliyah, I mean, you know about Atlanta because you are in Atlanta, even though you're going to the University of Alabama. Tell us about how your living quarters are going to be set up.
So right now they have it set up to where people that are living on campus are getting tested right before they move in. And if they test positive, they get placed in an isolation dorm where they are paired with other people that have tested positive within that move-in day. And then they're forced to quarantine for 14 days. Then they're tested twice after the 14 days are up to see if they are still testing positive or not. And if they're not, they get to move back into their dorm. And so right now, all of the housing is generally the same as it was prior to COVID. We have 4 people to a suite. We have 3 people to a suite, and we have 2 people to a suite as well.
Have either of you all been tested? And if so, I mean, what was that like? Just your reaction to the testing?
I have not been tested yet.
I've been tested twice. Oh, sorry.
Twice? And what was that like?
The first time, it was a smaller Q-tip, so it didn't hurt as much. But the second time, it was a longer Q-tip, and it hurt for like 5 minutes.
But let's talk about your level of fear and concern. And I know you said, Nash, after your mother said, you know, here are the things you got to think about, people coming from everywhere. How, on a scale of 1 to 10, let's start with Aaliyah, your fear factor, where is it? 1 to 10?
Honestly, I would say a 1. I think I've definitely cast in my care. I'm a believer and God gives us wisdom. That's just what that is. And so as long as I'm doing everything that I need to do, whatever's supposed to happen will. And I'm just doing my best to stay safe and keep my family safe as well.
See, that's why she's going to study religion at Yale when she graduates. I would like to find out from both of you guys. I know you haven't seen a lot of your friends that you go to school with probably, and everybody likes to get together when you get back on campus and socialize and everything. Nash, what are you thinking about that?
We can call. We can join a FaceTime call. I think that's the best thing that I could do with my Morehouse colleagues at this point right now.
And what about you, Aaliyah?
We definitely plan on linking up and engaging in person. Now, whether we'll be having masks on or we're trying to set up a system within my friend group, quarantining for 14 days. And then linking up on the 15th day to make sure that nobody has symptoms and that everybody's safe. But we haven't seen each other since March. So, I mean, FaceTime works, but it's nothing like being in person with the people that you care about.
You miss your friends and you want
to better pack these, Carolyn. One of these.
Absolutely. Masked up. Yes, be safe. Well, we can't thank you all enough. We're proud of you. We're excited. We want you to stay healthy and happy, obviously, and do well in the school year. So we'll check back in with you. Stay safe. All right.
Yes,
Thanks
ma'am.
for having us.
Thank you, guys.
Thank you, guys. You know, Carla, Leah talked about, you know, getting together with people, and that is so important. And a great story that we got out of Texas of people getting together in a neighborhood. You know, a lot of times in the summer they do these en blanc events where people
the white parties.
Yes, the white
on the lawn.
parties. P. Diddy does his, I think, at the Hamptons. Well, here it is in Dallas, or actually it's not Dallas, it's Texas though. And they pulled out their white tables, their tablecloths, their outfits, and doing their thing, and was so excited to see that. I'm on a group on Facebook, Women Who Love Outdoors, and I tell you, these ladies have been doing some work on some outdoor spaces in the time that they've been in quarantine. And a couple other quick follow-ups. You remember our little girls in Minneapolis that came together, the neighbors in the neighborhood came together
Yes.
to decide to do some good, raise some money for families that were in need after the George Floyd. Well, they shipped us our bracelets, and I had mine on. I guess I just twisted it off. But yours is in the mail. It will arrive to you. And
thank you, darlings. And thank you, Carolyn. Oh, they're such sweet girls.
Creative hands together. Congratulations to them in this campaign and getting it all together and sending a thank you. That's good customer service on a new business. You want to do that always. I see one other thing we want to tell you about, because we believe in follow-up. You remember Dr. Hildreth has been with us since the very beginning. Well, he
Yes.
is now being heard or understood in Spanish. We have got Spanish translation that is in place for those who are using these PSAs off-site. We thank you for doing that. Please write us and let us know how that's working for you and what the response has been. But you can now go to our page and see the Spanish version of Dr. Hildreth.
So adios to you, Carolyn, and to our friends.
Au revoir, en blanc, au revoir. Have